to leave. Everybody needs to have equitable access to good oral health. They need to be able to access providers. They need to be able to access a way to pay for dental services, and everybody needs an equal way to understand why accessing dental services is important. I think the value of bringing the Oral Health 2020 project to Kansas is in bringing so many partners and stakeholders to the table to work on one set of goals together. Even though lots of different partners are working on different pieces of the Oral Health 2020 goals, we're kind of working all in service of a greater vision.
The Kansas chapter, American Academy of Pediatrics, has over 400 members. They are private practitioners, academicians, or residents, and our major goal is to advocate for children's and children's health. The goal for our partnership with the DentaQuest grant with Oral Health Kansas was to be able to increase the number of pediatricians that were going to incorporate the procedure of anticipatory guidance and applying fluoride varnish for children ages 0 to 2. Because most of them do not see the dentist before the age of 3, this is important to get the pediatricians involved because they are seeing these kids already, and they have the opportunity to refer them to a dentist if there are major issues.
Through the grant that we've been working on over the past year, there are a couple things that we've been working on. One is provided a Teeth for 2 training, which was looking at specifically targeted towards home visitors and their skills in working with families around oral health. Then we also have some literature. We call them fast facts. So it's the English on one side, Spanish on the other, fast fact about oral health. We have like a community event to educate folks, and we're calling it the All Aboard the Cavity Free Express. And so it's a event where we're partnering with, most of the time, the Head Start program, and then a dental clinic or dental providers within that community. And there are stations set up to educate the families that come in about the importance of oral health. And they get a dental screening, and at the end, they're meeting with somebody to then take what you learned from that day and make an action plan.
There's a lot that the Safety Net primary care system is doing to help with this issue. We have about 44 member clinics that provide primary care and prevention services. Of those 44, 21 provide some sort of dental or oral health services. But then we have learned that if we take a more systemic approach, when we think about whatever it is that we do with our member clinics to help them to integrate oral health and dental health services within primary care, we need to do it in a way that's sustainable. And the statewide collaborative partnership has been wonderful in helping us to think that through and to use the resources most wisely, because we know they're limited resources and they may not be there forever. So we want to make sure that what we put in place through this project is something that's going to be sustained long-term with all of our member organizations.
We are working with those clinics that do not have dental services to look at how they may be able to elevate oral health in their primary care practices. So with a couple of them, we are employing a pilot project where in the primary care practices, they are providing oral health assessments, fluoride applications. They are working with dental partners, safety net clinics in their communities where they are referring patients for dental services.
Since 1967, we have helped individuals address their mental health and substance-related needs, and in doing that, we have realized that to truly help individuals be healthy, we have to also help connect them with resources to meet their physical health and their oral health needs. When an individual may have an abscessed tooth and they also have an anxiety disorder, the abscess increases the anxiety, so makes the mental health condition even worse. So we needed to reach out and see how we could work through some partnerships to develop a clinic for our consumers in meeting that needs. Our goals for the first year were pretty simple. First, we wanted to be able to help our consumers access dental services. We have reached out to Oral Health Kansas, who was able to get us in connection with Community Health Ministry. We have since formed a partnership with Community Health Ministry to provide an on-site dental clinic for our consumers. The dental clinic provides dental examinations, dental cleanings, diagnostic x-rays, fluoride varnish, and chairside education. And when services go beyond what we can do within the dental clinic, the clinic refers individuals to community providers.
If I'm a consumer and I don't have dental insurance, then I'm going to probably be less likely to go out and seek the kind of preventive and restorative care that I need.
What we have found is, an individual may come into our dental clinic, they have a cavity, they need a filling, and although Medicaid established dental benefits for adults in 2013, there are a few community providers who will serve adults with Medicaid, and even fewer who will serve individuals who are uninsured.
But there are reasons why dentists are not Medicaid providers. One of those is since 2001, there has not been a single increase in the rates for dental procedures. We're down to less than 50% of the actual cost involved in a dentist providing care.
To the extent that we as a member organization can help our member clinics integrate oral health and dental services within their primary care, I think it provides those who don't have insurance or who have limited insurance or limited resources, financial resources, a place to go to get the kind of oral health and dental services that they need. And I think that's going to be critical when we're looking at having a shortage of 8 out of 10 counties don't have sufficient dental capacity.
The pilot program that we started this last year, it was instituted in the mid-year, and it is focused on 5 clinics that are FQHC, Safety Net, and 1 individual outreach, and they work in specific regions of the state. Seeing them grow and think about something new, I'm really excited to see that move into the other clinics that we have with outreach.
Particularly in our rural areas, but not limited to our rural areas. Access to providers is a very serious issue. Even though we've now included dental services, some limited dental services for adults in our Medicaid program, we're finding that just 6% of those eligible are accessing dental services. The flat-out reality is we have to expand Medicaid, not only to cover those people who don't have any coverage at this point, but to take care of our rural hospitals and our providers.
Some of the ways that we've achieved is by starting to collect some data, putting the systems in place to where we can collect the data. That's been a really big piece, is doing the background work to build the system, determining which measures are important to collect. So we've done that background work. We're starting to collect some data that we feel like are important clinical measures.
We're looking at the pre-K population more intensely than we have in the past to get kind of a baseline of what is the oral health need within the state of Kansas among 4-year-olds. And so that'll give us a baseline of data after we analyze that to figure out what's the need and are there gaps or disparities so that we can maybe plan future activities.
We also got to work a lot with the Head Start Association, which we have not done so in the past. But now being able to gather that data and put it into our system, I think it's going to be able to show more of the population and what's going on.
One of the things that we want to expand on is there a way to track when these children are getting their fluoride varnish applications? There seems to be a little bit of an issue with everybody doing this, of being able to track how many times each of them have completed their fluoride varnish.
I think one of the biggest challenges we face is a lack of knowledge around oral health and how that affects your overall health.
When it comes to just people's understanding of early childhood oral health and the importance of it. And so whether you're a medical professional or a professional working with parents or a parent yourself, just the word hasn't really got out to everybody yet about the importance of care prior to 1 year of age and seeing a dentist before you're 1.
There is so much literature out there on one thing, and if we can all be saying the same story, that will give people more confidence in what we're saying. Because what happens when you go in and your nurse might say one thing and your doctor may say something else? If we can actually have one voice on topics, I think it is beneficial to all.
There are so many things that are exciting about year 2 for this grant. One of them is just expanding our network. We are going to incorporate a tool called the Partner Tool, which will expand our network to really diverse stakeholders, which we don't currently have, and bring new people to the table, kind of expand our reach throughout the state.
We have a great opportunity with the partners that we have now, and we've really used this formative time to fine-tune that, but now it's time to reach out and pull other people in, and I think we're in a really good position to do that.
Oral health is linked with physical health, is linked really with even behavioral health. And if we're not addressing that totality when we work with our patients, we're not going to be making the significant strides that we want to achieve.
I'm very excited at the prospect of the second year. I think that when we look at the support that DentaQuest has given to the state in the past, we really owe a lot to DentaQuest. They are behind the dental hub that allows us to now have 21 dental safety net clinics in the state that provide care to 89,000 Kansans, and that is huge.
Kansas has been known as a leader in early childhood for years. We need to keep working at what we're doing.
DentaQuest 2020 goals are about more than just oral health. They're about achieving just health equity. I think I can speak for the entire Kansas Oral Health Connections team when I say that we're really excited about these projects and to turn these goals into reality.
I think what's exciting about year 2 is that we've got so much momentum and so much excitement and so much progress that I think it's gonna, I don't even know where we're gonna go. In a year from now, I think we're gonna have a lot of exciting things to be talking about.